Hello, thank you for your time and attention today as we explore policy options to support immigrant women experiencing domestic violence in the state of California, with a focus on expanding access and equity to domestic violence services. We believe that combined support from the California Legislative Women's Caucus, the Department of Social Services, and the Governor's Office of Emergency Services will result in successful implementation of policy action and community-based programming to reach immigrant women who live in rural and underserved communities. This project has been completed by MPH candidates at UC Berkeley, Brittany Kintigh, Emily Harper, Faizah Lodhi, Jennifer Lamb, and Kristen Guerrero. While much of this information in the presentation is informed by current research and legislation, it's vital to work in partnership with community members directly impacted by issues we seek to remedy. To this end, our team consulted with staff from Casa de la Familia, a Los Angeles-based nonprofit organization providing mental health counseling, domestic violence advocacy, and community outreach to women who are immigrant survivors in Orange County, LA County, Kern County, San Bernardino County, and San Diego County. We would like to acknowledge and thank the staff at Casa de la Familia for their insight, expertise, and time in forming our project.
For the purposes of this presentation, the term immigrant shall refer to foreign-born people with either legal or non-legal statuses. California is home to 10.6 million immigrants, including 1.8 million undocumented individuals. Immigrant women in California face an increased risk of domestic violence for many reasons, including fear of deportation and ICE involvement, limited awareness of legal rights and protections, cultural stigma, language barriers, and emotional manipulation. Furthermore, there are no current state laws that prevents ICE from entering DV shelters, and long visa processing delays up to 5+ years leave survivors legally vulnerable. The consequences of these barriers include underreporting of abuse and underutilization of existing resources, prolonged exposure to violence, including leading to physical harm, poor mental health outcomes such as PTSD, anxiety, and depression, legal and economic instability, increased risk of homelessness upon fleeing violence, and intergenerational trauma. Advocacy groups and policymakers, Immigrant Legal Resource Center, La Casa de las Madres, and Senator Rubio define this as a public health, human rights, and urgent policy issue. So why now? Domestic violence is both a process and outcome issue. Systemic barriers such as language, access, and cultural lead to harmful outcomes like trauma, economic dependence, and underreporting of abuse. Fear of immigration enforcement silences survivors. Abusers weaponize immigration status using threats of deportation and emotional control to isolate victims and prevent them from seeking help. Multilingual resources are uncommon, leaving survivors without reliable support. And lastly, California lacks consistent implementation of legal protections. California's immigrant population is large and diverse, yet statewide policies and funding have not kept pace with their significant needs. We conducted this analysis to address the urgent need for safer, more accessible DV services for immigrant women in California. We believe California state lawmakers and the California Legislative Women's Caucus, leadership at California Department of Social Services, and Cal OES are best positioned to take action on this issue for their commitment to gender equity and public safety, their political investment in supporting vulnerable communities, which includes immigrants, their authority to allocate funding and implement statewide DV policies, and their ability to advance culturally and linguistically responsive services across California.
The public health issue we're addressing is the high risk of domestic violence among immigrant women in California. Immigrant women in California are at a disproportionately high risk of DV compared to US-born women. According to a recent study conducted by Morrison and colleagues, prevalence rates among immigrant communities reach up to 93%, which is about 2.5 times higher than among US-born women, who are at 36.4%. These numbers are likely underestimated due to underreporting, fear of deportation, language barriers, and lack of trust in the legal system. When considering policy alternatives, we begin by examining the status quo, which involves maintaining the current legal protections. Alternative 1 proposes funding multilingual DV services with coordinated legal aid. Alternative 2 focuses on establishing a culturally responsive prevention education program, while Alternative 3 looks at expanding telelegal services to underserved communities. Immigrant survivors of abuse face significant challenges, and while there are legal protections in place, these protections are often limited and underutilized. Current laws provide some safeguards, such as the Violence Against Women Act, which allows an abused spouse or child of a U.S. citizen or lawful permanent resident or an abused parent of a U.S. citizen to self-petition for lawful status in the United States, receive employment authorization, and access public benefits. The U visa offers immigrant survivors of certain crimes who have been helpful in a criminal investigation or prosecution a visa that will eventually lead to a green card. And the T visa protects survivors of sex or labor trafficking.
Our first proposed policy alternative is restoring grant funding for DV services in California. 78% of federal funding through the Victims of Crime Act has been cut since 2018. As federal funding declines, state funding has not filled the gap, and no additional dollars have been allocated to backfill cuts in the current governor's budget, even though more federal cuts are expected. In addition to restoring DV service funding by $30 to $50 million annually, this policy alternative develops a carve-out of $2 million to be allocated annually for culturally specific, multilingual DV services and coordinated mobile legal aid units in all counties. There is a precedent for equity-focused grants allocated through Cal OES for DV services that supports the LGBTQIA+ community. We're putting this proposal forward because there's a large gap in the need for DV services that are accessible, equitable, and trusted by the immigrant community. Foreign-born women in California face higher rates of domestic violence than U.S.-born women and have had additional barriers to accessing support due to linguistic availability, immigration status, cultural stigma, and limited legal knowledge. Yet, 37% of California counties lack culturally specific DV programs, rural areas have far fewer access points to services, and 1 in 3 DV shelters have no bilingual staff. Community-based organizations and legal aid providers qualifying for grants would coordinate social services with mobile legal aid units to provide services such as mental health, case management, DV advocates, and support with basic needs alongside legal services that are geographically accessible. Promising practices in San Joaquin Valley through the Immigrant Legal Resource Center provide a model for combining these social and legal services in rural areas. Grant applications would be prioritized by areas with the highest need and then scaled statewide over time. For our second alternative, we're proposing the establishment of a culturally responsive statewide domestic violence prevention program housed within the California Department of Social Services, who would be charged with developing educational materials, training opportunities, and strategic development for organizations providing DV services. The goal of this program would be to work closely with community-based organizations and trusted local partners to strengthen organizational capacity for culturally relevant, accessible prevention and education for domestic violence. We're putting this proposal forward because prevention education is underfunded in California, and there are not enough resources dedicated to culturally competent prevention programming. The impact of generational and community violence, social and emotional isolation, and norms related to gender inequities is unequal across communities. And as these factors increase, so does disproportionality in domestic violence rates for immigrants compared to white US-born women. Yet, a strong network of domestic violence prevention initiatives and partnerships across sectors exists, with models to engage multi-sector strategies to reduce incidents of domestic violence by increasing healthy community relationships, economic opportunities, strong social networks, and trust. This program would be operated by CDSS, funded to partner with trusted community-based organizations and develop culturally relevant prevention campaigns and curriculum. CDSS would also be mandated to develop local commissions in areas with highly underserved immigrant populations to develop community-wide strategies that prevent domestic violence. Finally, people who have a cultural connection and lived experience as an immigrant survivor will have access to free, culturally competent DV advocacy training across the state. For our third alternative, we're proposing expanding existing legal aid capacity in California by increasing access in rural and underserved areas to telelegal services, specializing in immigration programs available to survivors. This alternative would be implemented through newly proposed legislation supported by the California Legislative Women's Caucus to increase legal aid funding with the aim of reducing waitlists for legal aid by greatly expanding telelegal services. We're putting this proposal forward because telelegal services reduce barriers to immigrant women accessing legal protections, especially in rural or underserved areas where local legal aid may not exist. In fact, of immigrant women experiencing domestic violence, 76% fear contacting law enforcement, and half withdrew legal cases due to immigration-related concerns. Women may lack transportation, fear stigma or deportation, and that further reduces access to legal representation. Additionally, rural communities with high immigrant populations sometimes have fraudulent immigration consultants, which further erodes trust in already often untrustworthy legal systems. To implement this service, newly proposed legislation would direct CDSS to distribute funds that enhance access to equitable telelegal services. To qualify as a telelegal aid provider, organizations would have to ensure services are offered in the petitioner's preferred language through bilingual attorneys or trained interpreters. It would have to include funding to implement local targeted outreach to increase access to technology, internet, and literacy support for survivors. For example, the expansion could fund access to safe devices, internet hotspots, or community centers equipped with private spaces for confidential telelegal sessions.
To evaluate each policy alternative, we used a set of criteria designed to measure their strengths. We identified 4 key criteria: efficiency, equity, legal and political feasibility, and effectiveness. We begin with efficiency. This criterion assesses whether immigrant-based legal protections are being accessed and are effectively reducing domestic violence among immigrant women. This criterion involves analyzing quantitative data, such as the number and approval rates of legal petitions, number of domestic violence situations reported to law enforcement agencies, and outcomes such as legal actions. This criterion is important because utilizing legal remedies for survivors of domestic violence is crucial to ensure safety, promote justice, and reduce exploitation, as well as support long-term recovery and independence. We measured efficiency as, could we increase the percentage of immigrant domestic violence survivors who successfully attained legal protections within 12 months of policy implementation? Now on to equity. This criterion assesses whether a policy reduces disparities and increases access to domestic violence support services for immigrant women across all counties in California. It addresses structural barriers such as legal status, language, and cultural responsiveness, especially in rural or underserved areas, ensuring that immigrant women are not isolated and can safely access support. Metrics include service utilization rates among immigrant women, a quantitative metric, organizing capacity to offer multilingual and culturally appropriate services, again, a quantitative metric, and trust indicators from community surveys, a qualitative metric. This criterion is important because immigrant women face barriers to accessing domestic violence resources, and those that exist are not linguistically and culturally accessible in many parts of California. Without accessible and culturally responsive implementation, a policy may exist on paper, but will fail to reach its target populations, ultimately undermining the overall impact. We measured this equity as, is there equitable access to DV services for immigrant women across California? And could we reduce isolation and increase service utilization by at least 15% within the first 12 months after policy implementation? Up next is legal and political feasibility. This criterion assesses if the policy aligns with existing federal laws, such as the Violence Against Women Act, and whether it permanently or temporarily can withstand legal challenges, as well as if it considers the stability of legal protections for immigrant domestic violence survivors and evaluates the durability of long-term political support for ongoing protections from DV survivors. A metric for evaluation can include the percentage of survivors that have long-term protection under current policies compared to those protected under the proposed policy. This criterion is important to our analysis because immigrant domestic violence survivors need long-term access to support in order to rebuild their lives while remaining safe. We measured legal and political feasibility as, could we maintain uninterrupted access to legal protections for immigrant domestic violence survivors for at least 3 years with no successful legal challenges undermining policy provisions? Finally, we look at effectiveness. This criteria evaluates whether immigrant survivors of DV are able to access locations that would legally be protected under the proposed Senate Bill 841. Those places are domestic violence shelters, homeless shelters, family justice centers, and hospitals, now that ICE presence has intensified. Both confirmed and rumored ICE presence can deter DV survivors from seeking care. To evaluate this, qualitative data can be gathered through interviews with survivors and shelter staff. Quantitative metrics include the number of ICE incidents reported, fluctuations in shelter or DV hotline usage, and the number of people accessing service in a safe sanctuary location. This criterion would help show how ICE activity disrupts survivor access to care and reinforces the urgency of implementing and upholding protective policies. We measured effectiveness as, could we increase the percentage of recent immigrant and undocumented survivors of domestic violence who report abuse or safely access support services by 25% within 2 years, while ensuring protections against detention or deportation are in place and clearly communicated?
This slide compares the 4 policy options that we mentioned before by evaluating the above terms that were just aforementioned: effectiveness, equity, efficiency, and political or legal feasibility. The status quo performs the weakest, with a score of only 4, reflecting minimal effectiveness, inequitable access, inefficiency, and limited political support. In contrast, grant funding emerges as the strongest option, with a total of 11. It achieves high marks for efficiency and effectiveness and equity and feasibility, though it is possible to note that efficiency is somewhat lower due to the cost and administration burden associated with sustaining grant programs. The prevention program follows closely with a score of 10. It is highly effective and equitable, but its efficiency and feasibility are more moderate, suggesting that implementation may face resistance or even have uneven compliance among providers. Telelegal services achieve a total of 9 and stand out for improving equity and expanding access across geographic boundaries. However, they remain limited by cost, reliance on technology, and barriers to digital literacy. Overall, grant funding offers the most balanced and promising pathway forward, while the status quo provides little justification for continuation. This slide outlines the practical trade-offs and outcomes of each policy option. Maintaining the status quo provides some benefit by continuing to offer survivors pathways to legal status and employment. However, long wait lists, fear of judicial system, and lack of services in underserved areas mean that outcomes remain highly constrained. In this scenario, waitlists for VAWA petitions would likely increase, and only a limited number of survivors would achieve lawful status. Grant funding offers trusted, community-based services that combine domestic violence support with access to legal aid. Its principal challenge lies in sustainability, as political and financial support for ongoing funding is uncertain, and rural areas may continue to face shortages of providers. Nevertheless, when implemented, this approach significantly improves access for survivors, particularly in rural settings. The prevention program focuses on strengthening of capacity of domestic violence advocates and service providers to support immigrant women more effectively. The risk is that non-compliance among some providers could reduce service availability, yet the overall outcome is positive, as trade providers would be better equipped to meet community needs. Telelegal services reduce isolation across geography and expand access to legal help. However, they are costly to maintain, require reliable technology, and depend on user literacy, leaving some survivors unable to benefit. For those who can participate, the outcome is greater connection and improved access. Taken together, these trade-offs show that while all policies involve limitations, grant funding and training provide the most meaningful opportunities for impact, with telelegal services functioning as a supplementary measure rather than a standalone solution. In the end, we recommend policy alternative 1, grant funding. This is due to the fact that it expands access in underserved communities, rebuilds trust through culturally responsive non-police services, restores service capacity across urban and rural areas, and supports survivors with legal aid and language access. Some limitations and barriers do exist, such as funding sustainability, where grants may create short-term gains but may not make long-term service. Administrative feasibility, expanding culturally responsive services may be hindered by shortages of trained staff. There could be implementation challenges in a variety of ways. And also, community trust is an issue, as rebuilding trust is going to be a big feat. Some knowledge gaps occur. First, most important is underreporting of abuse. There's lack of data and reporting, and the underreporting is due to fear of deportation, language barriers, and lack of trust in law enforcement and the legal system. This underestimates the true scope of the health issue. Further research should aim at capturing complete meta-analyses to understand the true depth of the issue in order to implement effective policies. Evidence of effectiveness, therefore, is also limited. Scalability models are not fully clear how lessons from urban implementation may translate to rural contexts. Evaluation metrics are not always available. And finally, intersectionality gaps occur where they may not account fully for barriers faced with people with multiple marginalized identities, e.g. disability, immigration status, etc. Thank you so much for listening to our presentation. Here are some of the sources we use, and we appreciate your time.